Okay, I'm delighted to be here. We're outside Conway Mill. I, as chair of the Health Committee, have brought the Health Committee here today to do a formal meeting. It's the first time ever the formal meeting of any of the committees have taken place in Conway Mill, and I'm delighted I was able to bring the committee here. Today, prior to our formal committee meeting, we're meeting with the Belfast Health Initiative. I think it's important as committees we get out and talk to people who are on the ground, we talk to the community and voluntary sector and actually give them a listening ear on some of the proposals they have to the formal medical interventions that take place within our health system. So as I say, I'm delighted we're here. Part of our formal committee meeting we'll be meeting the ambulance trade union. We'll also be meeting the ambulance service, and we'll be talking with officials dealing with legislation that the committee is currently dealing with.
Well, from the Health Committee's point of view, I think it's very important to get out in the communities, and I think to be here in Conway Mill today, which is a place I have some familiarity with, I've been in it a few times before, didn't realise the scope of the activities in here, and I think it's important that the committee, and particularly people from other parts of the north, realise the type of work that goes on here in West Belfast and how important this particular building is to the people in the area. The Health Committee has an important role, particularly with the changes in transforming your care, the advent of that and the effect that it's going to have in people's lives. And I think it's important that communities realise that we're not just stuck on Stormont, that we just don't sit there up on the hill and do nothing in a sense, but we actually want to engage with communities. I think that's very important.
Well, it's critically important that we, I suppose, embed ourselves in communities. We're from communities, we live in communities, and we know the issues. The health service generally is facing one of the biggest transformations that it's ever faced in relation to the whole transforming your care agenda, and it's critical that communities like this are recognised in that debate. And it's very clear that there's real health inequalities across the north when we look at areas like West Belfast, North Belfast and Féin. So there's a need for us to be ensuring that whatever changes are being made actually have the outcomes that are required in terms of these communities. So it's critically important that the Health Committee, in our capacity as holding the department to account, and the Minister come into these communities and see at first hand the work that's going on a daily basis and how we can support that and ensure that there's measurement and outcomes that are for the betterment of everyone in our communities.
Today's meeting went very well. I think it's important that we get out of Stormont and actually get out and meet with groups and organisations who are involved in all sorts of health care, and I just thought it was important that we meet a group who deals with alternative medicine, including homeopathy. I think it's important that we've came here to Conway Mill, and I think it's important that this is the first time that any of the committees in Stormont has met formally in Conway Mill, so I'm delighted as a constituency MLA I was able to make that happen. And I mean, as chair of the Health Committee, I'm quite keen to get out and talk to people who are involved in frontline services. I'm quite keen to get out into communities and hear first hand the views that people have within the health or about the health service. And I'm quite keen that together we can make a difference.